let's stick to this to El Paso story, because I saw this one thing that pissed me off today from my mayor. He was on GMA this morning, and yeah, he put his foot in his fucking mouth, or at least, yeah, whatever. I'll just go to the fucking video.
Focus now to El Paso, Texas, where the city is struggling to keep up with rising COVID-19 cases. Hospitals are reportedly so overwhelmed, they are relying on jail inmates to help move bodies, and doctors
downtown.
say they are having to make wrenching decisions about who gets care and who doesn't.
Meanwhile, there's been some political bickering. Some back and forth continues between the local government officials fighting over how to stop the spread of the virus. Let's see what's happening there. Let's go to the man in El Paso, Texas, Mayor Dee Margo.
The man.
Thank you so much. I know it's a very busy time for you all, so we appreciate the time. Can I ask you first, what is it you need that you are not getting right now, whether that's from local officials, state officials? I know you need people to behave the right way, but as far as resources go, people want to help El Paso right now. What do you need?
Oh, do they?
Frankly, right now we're receiving all the resources and assets that we need. Both the federal government and state government.
Jesus, man.
Over 1,056, I think, medical personnel that have been brought in. That's physicians, nurses, technicians.
Oh, we're doing fine.
This is our 5th week with this spike. I was hoping that we'd start to see a curtailing now.
This motherfucker doesn't care at all.
Yesterday and the day before, we're below 1,000 positives coming in, and we tested almost 600,000 El Pasoans. But today we had another rise to 1,062. And I mean, as the CDC said earlier this week.
By the way, today another 1,000 dead, another 22 dead. Yeah, another 22 dead, another 1,000 infected.
To be hospitalized because of COVID than any other than the normal Caucasians.
Mayor Margo, how would you describe
did you hear that?
the situation there on the ground in
Hold
the
up,
hospitals in El
just
Paso?
put that on replay.
And do you
Than the normal hospitalized because of COVID. I mean, as the CDC said earlier this week, our population is 85% Hispanic, and we're 4 times more prevalent to be hospitalized because of COVID than any other than the normal.
Who's we, motherfucker?
Caucasians.
Mayor Margo, how would you describe the situation there on the ground in the hospitals in El Paso, and do you have an explanation as to why this is happening?
If you're the journalist at that point, do you ask them?
We're a highly vulnerable population, and it's community spread. What we found out that is, we did a deep dive from October 10th to October 16th and on contact tracing just a few days ago. And we found out that 55.11% of our positives were coming from retail shopping, primarily in what we would term the big major retailers, the big box stores. So it's a community spread. We're trying to restrict that as well.
You said 55+% is from people out shopping. Shut the shopping down. Why isn't that something you're screaming from the mountaintop?
The economy.
Because what you cannot shut down are the essential businesses, as stated under CISA with the Homeland Security directions. So I can shut down the mom and pop stores, and but that doesn't deal with the major box retailers, the Walmarts, the Costco's, you name it. Those are the ones that remain open under CISA guidelines. So all we do with a quote shutdown unquote is penalize the bookstore on the corner, and people go to one of the big box retailers, Sam's or whatever, and buy their books. We shut down the Hallmark card shop. They can walk into Walgreens and buy a greeting card. That affects
workshop
the lowest
messaging.
rung. I don't have control over that. But what I do have control over are the limitations on service. We shut the restaurant bar areas, and we had bars are not open, but some of the bars have converted to restaurants under Texas guidelines, and we have shut those down at 9 p.m. I did that almost 5 weeks ago today, yesterday.
Oh, great, 9 p.m.
To 9 p.m. and takeout only. And we understand from our code enforcement that seems to be working well. They're stopping the congregating. They can do takeout after 9, but they can't continue there. So we're dealing with those areas that we can deal with, but to do a quote shutdown only impacts those who are most harmed by a shutdown, and those are the people on the lowest rung of the economic ladder. You know, shopping here is a family event. It's multiple generations. It's
guy's
more
such
than
an
one.
asshole.
Yeah.
We've asked that they restrict that. We've also gone to the major retailers and asked them to do metering, which is a limitation on the occupancy of their respective stores. And so Walmart has come back and said, yes, we're still talking to the others. We're dealing with the areas that we know where its spread has come from and trying to restrict. We have a mask order. We've had a mask order since day one. You get a warning the first time, and then it's a $250 fine each time you not wear a mask after that. But we're going to have to continue to learn to live with this virus until everyone is vaccinated, and we don't think that's going to occur until probably the middle part of next year.
It is certainly a long.
All right, that's enough from you. Ugh. Okay.
That message he said, right? Like that's something that they workshopped. It's like this ties into what we were just talking about. It's like it's not that they have a good affirmative message for them, right? Like it's not like they have a good message for why they're good. It's that the way that their messaging works is that they're able to discount their opponent's message, right? They're able to take what the Democrats say and debunk it or somehow flip it around and make it a negative, right? Like they're not good at selling themselves, but they're good at shitting on the Democrats.
Right. So we had a comment from Vero Carvajal, who was running for mayor, and we have had her on the show, and she's awesome. So this is what she had to say about Margo's comment. So Margo on GMA, Hispanics are more likely to be hospitalized than normal Caucasians. We have higher numbers because we are 83% Hispanic, and our population has higher rates of high blood pressure and heart conditions. But this is the part. We have higher COVID numbers because we've had an incompetent mayor and city manager unwilling or unable to see past their own racial biases, much less address systemic inequities in our workplaces, healthcare, air, and federal COVID, and shut down irresponsible and or unsafe businesses. Yeah, that's.
I don't think that's right.
Yeah.
I don't think that's right though, because I think that the racial biases are part of it, right? Like they're aware of the disproportionate effect, and that's what's fueling their their lack of concern, right? Like they know that it's just poor working class black and brown people who are mostly dying, right? So
and then
they're seeing.
We also heard from
that
nurse too that kind of echoed that same sentiment when it comes to treatment, that there's a but I mean, there's an 83%, like they're mentioning, 83% Hispanic city here. And I mean, look, from what when Margo goes out there on GMA and says, I mean, you can kind of venture to guess where his attitude lies on that front, and the policies over here that he's implementing, I would characterize them like Vero did, where they are incompetent. There's more shit that he could be doing, and he's just not, based for economic reasons. The pushback that was coming from the county judge's decision to issue a citywide lockdown was pushed back by his office, by the city, and that's how it ended up going to the state court. And the state court was always going to rule against any kind of COVID lockdown. It's all right wing controlled. Of course it was. So, if it was going to be a thing where you're wanting to go ahead and maintain public safety, then maintain public safety. But
it's like we know how to stop it. Like we know how to get people to stay in, right? Like at the beginning, people stayed in because we had to shut down. There was only the big retailers, like the way that he messaged that, saying, oh, well, I'm not going to be able to close down Target and the grocery store, so that's just going to hurt the poor mom and pop businesses. And it's just like, you have to bite that bullet and help them get through it, right? Like that's what a competent government that cares about people dying does, right? They understand that, so they pay them to shut down, or they back up, they backstop them, right? Every other country that did that was successful. It's like Bloomberg has this piece here. I don't know if you saw that that thread about the types of social unrest. They say, I'll just read it.
Yep.
In early November, 20,000 people marched on the streets of Leipzig, Germany to protest restrictions, flouting rules. All about 90% of them refused to wear masks. A similar rebellion against social distancing rules has happened before.
Mm-hmm.
Seeing quarantines and lockdowns as unfair and tyrannical punishments, people took to the streets, and this was 1625 in London from the plague. And in 2020, people marched, rioted, or protested from Trafalgar Square to Michigan State House, sometimes armed with guns. There have been more than 30 protests in 26 countries between March and October. But the protests in Leipzig or Michigan, Britain, or Australia only represent one category of unrest. These rallies vent the frustrations of relatively well-off people living in prosperous and functional democracies. That's debatable. A different category, there are protests against governments or leaders suspected of being corrupt in Bulgaria, incompetent in Brazil, demagogic, illiberal, and even undemocratic in Israel and Serbia. The third type is mobilizes people who fear for their livelihood. Malawi, how do you say that? Malawi.
Yeah.
Street vendors march with signs saying we'd rather die of corona than of hunger. Ecuadorians riot against the shutdown of state-owned companies and salary cuts. And then there are the protests that have little to do with COVID-19, but probably became more urgent or bitter in the pandemic's context. Black Lives Matter, for example, spread to at least 16 countries, from France and Britain to Brazil and South Africa. And just the start. COVID-19 has rekindled old divisions across the world. In the U.S., Black Americans suffered disproportionately from police brutality, but also from coronavirus. Now these traumas merge, and everywhere the poor fare worse than the rich. Even before the pandemic, we were entering the age of mass protests. The number of uprisings globally has been increasing by an average of 11.5% a year since 2009. COVID-19 is just the accelerant. It's interesting how they don't have any solutions, right?
Yeah. But just to jump back really fast, I wanted to throw up this article too because of how that my mayor mentioned that we're getting all the resources to to fix the problem. Well, the Texas National Guard now is deployed personnel here to help with the morgue overflow, just to give an idea of how things are going here.
That's good for them.
Yeah. So the Division of Emergency Management said in a statement after completing an assessment of the situation on the ground in El Paso County, the state has mobilized a team of 36 National Guard personnel to provide mortuary affairs support beginning at 0900 tomorrow. That a rapid increase in cases and hospitalizations has brought on a spike in deaths. Oh, you'd think. The Texas military will now provide the critical personnel to carry out the city's fatality management plan. Fucking dystopian, bro. El Paso City and County has secured a central morgue location to further support the medical examiner's office, funeral homes, and mortuaries with additional capacity. There are more than 300 people in intensive care across El Paso County due to COVID-19. Earlier this month, they were bringing in 10 temporary morgue trailers. So many have died that the county has posted job openings for morgue attendants. And El Paso was paying prison inmates $2 an hour to move the bodies, and we talked about that.
Mm-hmm.
Apparently now they're taking on volunteers and paying them $27 an hour.
Damn.
Yeah. So El Paso is just one area being hit hard among the nationwide virus surge. The U.S. recorded 195,000 new cases. But, El Paso health officials reported 1,074 new COVID-19 cases, 8 deaths on Saturday, bringing the totals to 80,000 cases and 853 fatalities currently. And, I think that this is an older article this was from today. So, I guess this is from today. We only lost 8 people compared to, I think it was 22 yesterday. So,
not bad.
Yeah, we're looking in the right direction.